this is Ward 3.
Hello, this is Dr. Smith, the on-call doctor. I've just been bleeped.
Yes, doctor. I'm calling in regards to a patient on our ward, Mr. Billy Bob. He's a 66-year-old gentleman admitted 3 days ago due to collapse secondary to hypoglycemia. He's had quite poor blood glucose control against a background of type 2 diabetes, ischemic heart disease and hypertension. I'm calling since I've noticed he's become quite short of breath, respirate 28 since I started my shift, and his temperature spiked to 38.6 in the last hour. He's quite tachycardic as well, heart rate 138 beats per minute. Up until now, the patient's been hemodynamically stable with no chest symptoms, but I'm quite concerned now, so would you be able to come and review the patient, please?
Okay, I'll be down in a minute. In the meantime, could you repeat a set of obs on them? Heart rate, blood pressure, respirate, O2 stats and a blood glucose. Could you get out the patient's notes for me and set up for a 12-lead ECG? And if the patient can, could you get a sample of their urine and dip it, please, just to check for infection?
Yeah, that's fine, doctor. We'll get that done for you.
Excellent, thank you.
Okay, bye-bye.
Bye.
Hello? Hello, doctor. I've left the patient's notes for a chart and ECG I've just performed over there. Just let me carry on and I'll update you when you examine the patient.
Perfect, thank you. I'll just have a read. Mr. Billy Bob, is it?
Yes, hello.
Hello, my name's Dr. Smith. I'm the on-call doctor tonight. I've just been called to see you because you're feeling quite unwell.
Yes, doctor. I feel so awful. I started having this cough yesterday. I've been coughing up this this dark yellow phlegm.
It sounds like you've got quite a nasty
Oh,
cough
it's
there.
horrible. I've been feeling really hot and sweaty. I just feel so awful.
Your sats are quite low. Sister, sorry, could we start this man with some oxygen, please?
Yes.
Thank you very much.
I'll give 10 litres for now for a non-rebreathe mask.
Can we aim for sats of 94 to 98%, please?
Yes.
Okay, so we're just going to give you some oxygen.
Okay.
Hopefully it'll help with your breathing.
Okay.
Also, I'm just going to give you this pop, Mr. Billy Bob. If you cough up any of the sputum again, could you just spit some in there so we can send it to the lab just to test for any infection?
That's fine.
Okay, I'm just leaving it there. Okay, so now I'm just going to examine you just so I can gauge a bit more about how unwell you're feeling.
Okay.
In order to do this, I'm going to need to see your chest. So is it alright if I just pull your gown down a little bit?
Go ahead.
Okay, thanks. So I'm going to start by feeling around your neck area. It might be a bit uncomfortable, but it shouldn't be painful at all, so let me know.
Okay.
Dr. Smith, respirate is now 24 and SATs have improved to 90%.
Okay, excellent, thank you. And trachea is central. Okay, I'm just going to place my hands on your chest, so just breathe as you are.
Okay.
Okay. I'll just pull this back up for you. I'm just going to press on your chest. Sister, sorry, can I just have another set of obs, please? Thank you. 1, 2, 3, 4, 5. 1, 2, 3, 4. And a cap refill of 4. And just another feel of your hands.
Heart rate is 134, SATs 91, temperature 38.6.
Okay, thank you very much. Just going to feel the pulse. Okay, Mr. Billy Bob, I'm just going to ask you a few questions. Have you ever had any breathing problems in the past?
No.
Have you had any chest pain recently?
No.
Have you been coughing up any blood at all?
No.
No, okay. And in the past, have you ever been to hospital for any clots in the legs or the lungs?
No.
No. Have you ever had TB?
No.
Or anyone in your family had TB? No? Okay. Have you lost any weight recently?
No, not recently.
No? Okay. So how's your appetite? Is it alright?
It's fine.
It's fine? Okay. Have you been vomiting at all?
No.
No? Okay, excellent. And one last question. Have you got any allergies at all?
No.
No? Okay, great. Thank you very much. Right, sister, can I just ask, can you insert 2 wide bore cannulas into this patient and take some bloods? FBCs, USNEs, LFTs, CRP, D-dimer, coag screen, and also some blood cultures if possible. We're just going to, after that, we're going to attach some fluids, give a dose of 0.9% sodium chloride, 500 ml over 15 minutes just to restore the low BP. Also, I'm going to prescribe some paracetamol in order to reduce the temperature. I'm also just going to have a look at the hospital guidelines for, I think this is going to be a pneumonia. So we're going to just check over that. Is that all right?
Yep, I'll cannulate the patient now.
Excellent, thank you. So Mr. Billy Bob, as you can see, we're a bit concerned just over your chest. We think you might have an infection. So we're going to start you on some antibiotics, hope you make you feel a little bit better.
Oh, okay.
Okay, is that all right?
Yes.
The patient's on Ramapril. Sister, we're going to have to hold that.
Okay.
I'll prescribe some paracetamol. So 1 gram of paracetamol. And they need some fluids. 0.9% sodium chloride. 500 mils. IV over 15 minutes. I'm just going to look up the antibiotics guidance for, so they've got hospital acquired pneumonia, that's tazocin. Right, that's all prescribed, so. Mr. Billy Bob, I'm just going to have to do another blood test at your wrist. It might be a bit painful, but it shouldn't last too long. Is that okay?
Yeah, that's fine.
Mr. Billy Bob, how are you feeling?
Awful.
Okay, the nurse is just going to hang some IV fluids and some paracetamol, so hopefully that'll bring your fever down.
Okay.
Whilst this is going on, I'm just going to finish my examination. Is that all right?
Yeah.
Okay, so I'm just going to have a look at your eyes.
Okay.
It'll be a bright light. Okay, excellent. There you are. No, sorry, when was the last time his BMs were checked?
I checked them just before you arrived. They were 11.6.
Okay, excellent, thank you. Mr. Billy Bob, just to monitor your urine, we're going to have to place a tube up your water pipe.
Okay.
There's a small risk of some bleeding and infection, but I'm going to use a clean technique to ensure that this is minimised. Is that okay?
Okay, I had one before, it's okay.
Excellent, thanks. Okay, Mr. Billy Bob, I'm just going to have a look at your abdomen if that's okay.
Yeah, that's fine.
Okay, have you got any pain in your abdomen at the moment?
No pain whatsoever.
No? Okay, let me know if when I press down you get any pain at all.
Okay. No pain.
Okay, thank you. Okay, Mr. Billy Bob, I'm just going to check your legs if that's okay.
Yeah, that's fine.
Excellent, okay. Do you have any pain in your legs at all?
No.
No, okay. Well, the blood pressure's still quite low.
Hello doctor, I've got the results of the bloods in the ABG back. White cell count quite high, 15.2, urea 8, creatinine 66, CRP 170, and the lactate on the ABG was 4.5.
Okay. Can we start with that tazocin that I've prescribed, 4.5 grams IV, and also, because the blood pressure is still quite low, once that bag of sodium chloride 0.9% is done, can we hang another 500 mils of that, please? I'm going to ring the med reg just to alert them about this.
Med Reg.
Hi, this is Dr. Smith, the on-call junior doctor. I'm just ringing because I'm concerned about a patient on ward 3, Mr. Billy Bob. He's a 66-year-old male, initially coming in 3 days ago for a collapse secondary to hypoglycemia. He's got a past medical history of type 2 diabetes, ischemic heart disease and hypertension. Currently I'm just concerned because he's got short of breath, pyrexic at 38.5 degrees and a productive cough producing yellow sputum. It's getting progressively worse over the past day. So his pyrexia, tachycardia and tachypnea, and so I'm suspecting pneumonia. Currently awaiting a chest x-ray and the sputum culture to come back from the lab. On observation and examination, I noticed he had coarse crackles on the left base and it was dull to percuss over the anterior base of the chest. Cap refill is currently 4 seconds. Recently his bloods came back, white cell count 15.2, urea 8, creatinine 66 when it was 54 on admission. It's got a rest rate of 24 breaths, heart rate of 122 beats per minute, blood pressure is 102/72, and he's currently on the second bag of saline that I've given him for a fluid challenge, 500 mils. SAT's 95%, but that's on 10 litres of oxygen through a non-rebreathe mask. Earlier he was 91% on room air. I've given him some paracetamol for a temperature initially and some antibiotics, 4.5 grams of tazocin as a stat dose for this hospital-acquired pneumonia. Just ringing just to confirm that this is severe sepsis. Also questioning, are there any other investigations you'd like me to order? And should I prescribe some maintenance fluid therapy for him?
If you continue with the fluids, please. I'll be down in 10 minutes, thank you.
Okay, thank you very much.
So this patient is clearly septic, and it's crucial to follow the Sepsis 6 guidelines, which involve the resuscitation of your patient, the constant monitoring of oxygen saturations and blood pressure. It's also important to find a source of that sepsis, and you should do a chest x-ray and urinalysis. If these are normal, at that point you need to consider pelvic and abdominal imaging too. It's important to give antibiotics early, within the first hour of meeting your patient. This is crucial, as most studies have shown that a delay in the administration of those antibiotics increases the mortality from the sepsis by 8% for every hour delay. Should you be having difficulty managing this patient or your patient is deteriorating, you need to call for senior help early. I'd recommend you have a look at the UK Sepsis Trust red flag criteria. They'll be very helpful in identifying those patients that require your life-saving therapy immediately.